for joining us at this short video on dermaplaning. My name is Anilsa Brown and I'm the clinical skincare practitioner with Anilsa Skin Essentials, and I'm going to be doing this demonstration so that patients can actually see the benefit of what dermaplaning does. Dermaplaning is a technical procedure that removes vellus hair, and it's great for fine lines, pigmentation irregularities, and it's for a patient that is wanting the skin to look soft, radiant, smooth, and clear. It's awesome because it removes all the dead skin cells, stimulating the cell renewal underneath the skin. First thing we want to do is go ahead and remove all oils, fats, and lipids from the skin so that we have a nice surface to work with. What I'm using is our own product line, Anilsa Skin Essentials Glycolic 20% Acid Wash. What this does is that it removes the oils, fats, and lipids, and it gives just a very nice clean surface for us to work with. I'm going to go ahead and vigorously wash the skin. So after we wash the skin vigorously with the 20% acid wash, go ahead and rinsing everything off and make sure that everything is completely removed. After we do that, we go ahead and dry the skin. And so it's completely nice and clean. Now we're going to go ahead and dry the skin. Once we dry the skin completely, we're going to apply the povidone iodine solution to the skin. And what that does is that it allows me to have a beginning and an ending because of the color in the iodine. So I'll show you how I do that. Like I said, the skin is now nice and dry. And we're going to go ahead and do the povidone iodine solution on the skin. I love this technique because, again, it really does give the practitioner a guideline to where we are starting and ending, and it also gives the hair something to adhere to, so when we remove the dead skin cells and the hair comes up very quickly, and it just gives wonderful results. Again, we're going to make sure that that's completely dry. And we are going to go ahead and start with the procedure of the dermaplaning. We do use a number 10 blade. Everything here is sterile and disposable. So I start at the forehead, glabella area. I start working up towards me. And you'll see that the hair will start to remove, and then the dead skin cells will start to come off. I am going to put a little area here so that you can actually see the hair and the vellus hair and the skin. Like I was saying earlier, dermaplaning really gives such a wonderful results to the patients that come in and have it done. It is probably one of the most sought after procedures here at our center because not only does it remove all of the unwanted hair on the face, but again, if somebody's coming in for fine lines and pigmentation irregularities, if someone wants to come in and start working with de-aging the skin, really works to stimulate the collagen and the fibroblasts underneath the skin because we remove the dead skin cells. It promotes cell renewal. And as you can see, it starts to remove everything off the skin. Patients can actually put on their makeup directly after if they desire. We do this weekly on some patients depending on what they're trying to work with, especially if they're wanting to target pigmentation irregularities. This procedure is not designed for someone who has active acne, but it's great for dry skin types. and great for all skin types and skin color. Okay, so now we're finishing up with our procedure, and again, really just removing all, and you can see how all the dead skin cells just coming off. Patients really enjoy this procedure. Instant results. So you can see the skin cells just coming off. After we do this procedure, we go and ahead and do extractions as needed for the patient. And then what we do is we do a vitamin C treatment, and that helps to reinforce the capillary walls, work with free radicals that are on the skin that can cause havoc. And so the vitamin C really helps to quell that. And we put in the appropriate moisturizer and finishing off with a good sunscreen. It's so important after dermaplaning that patients really hydrate that skin and use a daily sunblock. We should use sunblock every single day to protect our skin. Number one cause of aging on the skin is not age itself, it's actually sun exposure. So it's so vital to keeping our skin healthy is by using a sunblock daily.